Hello, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Today, we'll be interviewing one of our patients who underwent a procedure, okay, with me, of course. This is actually her first major aesthetic surgery. So we want to know what was her journey for this procedure. And let me introduce to you my patient, Miss Ria.
Hello sa lahat ng fans ng Fat Sucker!
She underwent the Hourglass Tummy Tuck 2 weeks ago with lipo of the arms and the back. Okay, and today we just actually removed her second drain. She's on her second week and she is actually looking amazingly well. Look at that. She was able to wear her clothes before.
Yes.
So tell us, Ria, tell us your fans, like, how did you decide to undergo the procedure?
It was a long 5-year journey. Profile of patient, 45 years old, 2 kids, 10-pounders each, very active, 3 times a week working out. Journey started when I hit 40 or even before 40. The weight wasn't getting shed anymore, no matter how much workout or negative intake and positive output, it wouldn't shed. So I researched what I could do because my stomach was really big.
Yeah,
That was
big.
the bad. I mean, apart from the arms being big, my stomach was really big. So it looked like I was 4 months pregnant, which
Every
is
day.
bad. Yes, every day.
Parang di po eh.
Parang 5,
Yes.
6. So,
How did
for
you
me.
feel? Like, syempre always nakaganyan. So you didn't look, how about in your clothes that mabigat?
Yes, confidence level very low. When I take pictures, I always have to be at the back of my husband para matago yung kalahati ng katawan ko. Or all na lahat ng angles na kunan pataas. The face is very thin, if you notice. Yes, if you notice. So, kaya kong dayain during
By one
conference
picture.
calls or whatever. Kaya kong dayain. But then, also the problem was, every time I do crunches or core workout, wala na siyang tension. I would have chronic back pains or dull back pains na nandyan lang siya. And I feel because the back is overcompensating for the bigness of the tummy. And I guess most of you will have that as well. 5-year journey, I interviewed 4 doctors. Fortunate si Doc Claude lang ang girl. I asked the right questions. I did a lot of YouTube. My brother is a doctor, so I also asked him. And he was all for it. So this is where we are now. 2 weeks post.
2 weeks post-op. Look at that.
Yes.
Yes. First mo to diba? This is the first. You're not the kind of patient na marami na napapagawa.
I've never even had
you.
Botox or anything like that. This is my first aesthetic surgery. So,
and it's major.
yes, if you ask me, apart from the health concerns, apart from be the best version of yourself, it's really doing the research and finding the right doctor. Siguro your fans will ask, bakit ikaw, di ba? Bakit siya?
Great match to kasi ako din nakadalawang tummy tuck na
First winner decision making with Doc Claude is because she is a woman. The 3 other doctors I interviewed were men. Doc Claude knows my body, knows what the shape of a woman's body should be, and I trusted her with it. No regrets. It came out even more better than I imagined. So my ask kay Doc, gusto ko lang makapag-belt ulit, makapag-tuck in. But she gave me more.
Pagsasaksakan kita sa bikini.
Hindi na, kasi matanda na ako. Okay na ako, basta wala nang bulge. But you never know, maybe I'll have bikini pictures someday.
Definitely, she will.
Number 2 is Doc was always available for my questions kahit anong oras. Minsan I'll text her, something pops up in my head, 10 p.m. May sagot.
Pagkugising pa.
May sagot po siya. The confidence was built early at the initial stage without face-to-face meeting her because we're in a pandemic. I noticed all the doctors that I followed, all of their tummy tucks, maybe because the technique of Doc is different. Most of them are straight cuts. Mukhang puno. So, to me, at that time, I didn't know anything about Hourglass.
Nagandahan ka na nun
Nagandahan na ako. Hollywood pa yung mga sinusundan ko. Research about the Hourglass and the technique. So, you also know paano siya to enhance your curve. Medyo curvy ako, so I guess hindi na yun mahirap. Research about it and ask questions. So, yun yung deciding factor. And of course, condition your mind. Be prepared for it also. For me, it was a journey. I had to work out and make sure, and even my husband told me, i-workout mo muna yan. Pag hindi kinaya sa workout, let's go. What Doc said during the initial interview, if you slim down, you're a big barrel now. If you slim down, you're only gonna be a small barrel. Now, there's no more barrel.
No more barrel.
It's Coca-Cola bottle.
Yes, it's like, watch out! Look at her now. She's able to wear her previous clothing.
Yes, with confidence. And Doc also saw the parts where it needed help. Like my butt, it needed help because may mga crevasse siya na butas. So, it's not like she does one area. She'll do a complete look of yourself.
Kailangan, it's a whole thing eh, no? Hindi pwedeng one part lang. Kailangan everything just blends with each other. Now, how do you feel post-op? This is just 2.5 weeks.
I don't know if I can, it's a general, cookie cutter that people get up and about after 2 weeks or 1 week pa lang. Actually, the next day, I wanted to stand up na ayaw lang ni Doc. The recovery is easy for me. I didn't think it would be this easy. The healing, the scarring, probably show you. Yes, and very informative. So, my drains were well taken care of. My sutures were well taken care of. My medicine, my post-operative medicine. So, I think if you just follow your doctor's advice, maging mabait kang patient, I think the more important thing is get back on your feet immediately.
Oo, totoo. The earlier you ambulate, the faster you will heal.
Parang I felt that parang I had to push myself. Although masakit pa, tayo ng konti, walk a little bit sa area.
Yes.
That really helped.
So, Ria is in sales.
Yes, I'm in sales. I'm in IT sales. I do a lot of front-facing with customers.
Kailangan best face and body forward.
Yes, and so even if this was a journey, it may look aesthetic to your viewers, but this was more of filling my cup first so I can give more. It's going to give me back the confidence I need as a mom, as a worker, as an employee, and probably give me back the confidence that I can share my blessings with others.
I always tell them like, do it for yourself and not for anybody else.
That's true. That one of the deciding factors is also it's for me. I didn't have to, in the eyes of my husband, I was the prettiest, I was the sexiest, regardless of an operation. So, thank you, supporter. It was definitely
really for yourself.
Really for myself. Siguro yung 3 takeaways, Doc, if you want me to share with your televiewers. Know yourself well, know your body, what you can do, what you want to achieve. After you've done that, think about, exhaust all efforts na. Try to exercise, try to motivate yourself to do better. And research and asking the questions to your doctor. Walang maling tanong. Magtanong ka kahit mukhang stupid or masasaktan ba ako? Is it painful? Tulog ba ako? Gising ba ako? Anong gagawin? And also the cost, di ba? Usually, mahiya tayo mag-ask ng cost, di ba? So, it's better that you're very open with your doctor to discuss these things para you can make the right decision. Si Doc Roura doesn't hesitate. Even if you won't do it now, he will address your concerns. So, medyo matagal din kami nag-usap bago nag-decide.
Umalis pa yan tapos bumalik.
Yes, nag-Hawaii
pa. Umiyak pa.
If you're doing something major, the ball is in your court. And ito, number 1 support group yun, the team of the Fat Sucker.
The Fat Sucker. Okay, thank you so much, Ria.
Thank you, Doc, and maraming salamat.
And thank you for the trust.
Yes, more to come.
More to come. To watch more videos, please click that button down there and don't forget to like, comment, and subscribe to the Fat Sucker channel. And again, this is the Fat Sucker, Dr. Claudine Roura saying, see you in our next episode. Bye-bye!